All right, well that was an amazing panel. So many things to talk about, but really you can clearly see that the folks who have come to join us in these discussions bring such a wealth of experience with them. And just to hear from the experience of Kenya, of Malaysia, of India, they really show what is possible given the right political will and given the architecture that's in place. And I think, yesterday we were having a phenomenal conversation with our colleague from GIZ, Tessa Lenneman, and we're realizing that a lot of what we are talking about here is an effort to take successes that have happened around the world and codify them. Try to make sense out of the experiences and the mistakes as well as the challenges that countries have made and learn from those so that others following in those footsteps have an easier pathway. So, as much as we love words and terminologies, I think it's these principles, the concepts of digital public infrastructure, the concept of what that is, build once, use multiple times, curate something for the greater good, and then facilitate an ecosystem that can be built around it. And we've heard just now so many great examples of how that accelerates progress, how that accelerates adoption, both in the public sector and in the private sector. So now we're going to talk about elephants. We're close to the national park here in Nairobi, but this is the elephant in the room when it comes to the excitement of digital transformation. And we wrestled through this, and we've heard some of the reflections in the last panel, is how do we pay for this shift in the digital health transformation process? As Hani said this morning, if you want to go fast, invest in innovations. If you want to go far, invest in foundations. I think that was the quote, so I'm trying to reuse that. But that's the tragedy of the commons, right? How many of you have heard of this concept, the tragedy of the commons, right? So the tragedy of the commons is a long-standing philosophical construct that is about public benefits. Public benefits are things that we all want. We all want roads, highways, running water, electricity that's on. We want PowerPoint slides that don't go off in the middle of our talks. But these are things that you need money, you need resources to pay for, and that's what we're going to talk about right now. So we're joined by some distinguished experts, and I'm going to invite them to come up shortly. Or if you'd like, you're welcome to sit here, or you're welcome to sit out there, and we'll come up after just a few minutes. But we'll have Ali Habib from the World Bank, we have Tessa Lenneman from GIZ, we have Michelle Monroe from the Global Fund, and Adele Wagaman from USAID. I'm not sure if Dr. Ayub is here. Dr. Ayub, you're here, wonderful. From the MOH Kenya. So delightful to have that great panel. And so, can we go to the next slide? So over the last 2 years, WHO, World Bank, Transform Health, we worked together to do a number of costing analyses on what is the gap in financing for digital health transformation. And one thing that emerged as a really clear message is that there was not enough resourcing going into the foundations, the infrastructure that's needed for digital transformation. And some estimates say that this is exceeding $12 billion annually necessary to scale these foundations. And yet only 0.4% of global health budgets are allocated toward these needs. Now, there's the gap. Information on how much is needed and who can make these investments is unknown. And we can't fix what we can't measure. So the number one gap, I think, is information. So last year when we were at the G20 meeting talking about digital transformation, our UNICEF colleagues did an analysis that shared that during the pandemic, over 10% of the total amount of money that was allocated for global health investments went towards digital health and information systems. 10%. That's a lot of money. But the majority of this money went towards bespoke immunization tracking systems. And very little of this investment went towards digital infrastructure, digital policy, or digital governance, or other foundations that would contribute to strengthening health systems. So it was about short-term solutions, band-aids, digital band-aids, and not building up the infrastructure. But that's understandable during a pandemic. It's not so understandable when you take this over the course of 20 years of billions of dollars of investments. But over the last year, the good news is that there has been a major shift. G20, G7, USAID, World Bank, UNDP, ITU, WHO, we've all come out with clear statements supporting digital public infrastructure as a way to reduce cost. And we've seen some phenomenal examples in the last panel about how those cost reductions are materializing. But it's also ways of accelerating digital transformation. It's ways of closing societal gaps. And we've clearly seen, why is health so inspired at the moment? I think it's because we've seen what DPIs have done for financial inclusion. And Kenya is a model for that. You look at the World Bank reports on how financial payments have transformed the landscape of financial inclusion in sub-Saharan Africa. It is nothing short of phenomenal. So very briefly, as we go into this panel, I want you to just think about this list, because it's not so much that we don't know how to raise money for DPIs, because DPIs are out there. We didn't invent them last week. They've been out there, they've been used for revolutionizing other sectors, including digital financing. But there are a multitude of creative ways across this library of how we can finance this transformation. So I think when you think about how we, as WHO, we support countries, and recently we launched, as we all know, the Global Initiative on Digital Health, where we're focusing on norms and standards and architecture that are really the key things to accelerate digital transformation. So how do we get there? We have some big questions, right? Here are the big questions. Who pays for DPIs? Are public goods free? And I think there's a good debate to be had there. How does the country finance this transition? You know, I was really impressed by Derek a moment ago when he was showing us that spotlight, and I thought, man, I still have tricks to learn. But then I realized it's the technology embedded in the screen. So, Derek, where are you? You disappeared, but it's a cool technology. They're big questions, right? So, how does the country finance its digital transition? And one thing I think we're excited about this with 50 countries in the room. How do we encourage G2G connections to help accelerate this process? And I know there's a number of countries that are looking at sharing their DPIs with other countries so that those countries don't have to start from scratch. So today we're going to discuss some of these issues in depth, looking at some of the models. And this is the slide I thought was up behind me a moment ago, but it's not. Now this is the slide I was talking about. These are some of the ways that we know that DPIs can be financed, whether it's through innovative financing, whether it's through user-based models, whether it's through philanthropic contributions, or even getting the private sector to pitch in and build infrastructure. I think if we look at the real world of hard infrastructure, we've seen quite a few examples where public-private partnerships have built public infrastructure for the good of the country at large. So let me invite Ali Habib from the World Bank, please, and Adele Wagman, and Tessa Lenneman, and Michelle Monroe, and Dr. Ayub Mania. Please join us. And I'm going to hand the floor now to Ali to first share with us some specific examples of how the World Bank is supporting countries in adoption of DPIs. So Ali, let me hand the floor to you.
Thanks very much for the opportunity to speak today. Always interesting to be on the spot about funding. So let me just see how the clicker works. Okay, got it. So a little bit about the World Bank's financing model, because I've had some conversations in the last 2 or 3 days that made me get a sense that people don't fully know that. So that's going to contextualize what I'm going to say. The World Bank is our funding goes almost entirely to ministries of health for health funding. It is very rare for us to fund, almost never happens that we fund an NGO or a firm to do something in country. We are not an implementing entity, we are a financing entity, and we're a knowledge entity. So it's not just the money, it's also the expertise that we have in the organization, the knowledge. You saw a number of times in the last presentation that Alan quoted a World Bank report, and that's the knowledge that we make available. So on specific to health, we in April made a commitment, an ambitious commitment to deliver quality health services to 1.5 billion people by 2030. And we're all here today because we understand you cannot do that without digital health. You just can't do it. You can't reach those scales without the kind of DPIs we've been talking about in the last couple of days. And so for us, digital health is, and this is becoming a mantra for us now, is a foundational cross-cutting strategic enabler for providing quality health services. You cannot reach this scale without digital health. So how do we do this? One, so for us, we're now working, our investments are largely going towards tools to help countries design or re-engineer their care delivery networks to make best use of digital technology. So this means a few things. One, we are developing tools to guide countries on how to do this, and I'll share an example with you shortly. We are also not talking about applications anymore. That still happens. We do get requests for supply chain management or a system for maternal and child health, but largely we are now seeing requests for ecosystems, architectures, blueprints, strategies. So the countries that we support are also seeing the value of this because we are getting specific requests to help with foundational work, which we've not seen before as much. And finally, the notion of capacity building, sharing resources, and DPI is part and parcel, as I said, of this ambition to reach 1.5 billion more people by 2030. So because we also want to walk the walk, just this morning, we released a toolkit that is now available on the internet that is designed to help countries implement their national digital health strategies. So what does that mean? We're talking about blueprints. So how do I develop a blueprint? What does it take? It's a methodology to do that. It follows the convergence process that many of you may be familiar with. And not just the blueprint, it also goes into a costing. So as Alan mentioned, a big problem is we don't know how much this will cost. And so this has a model for a 10-year costing for how to set up an HIE and maintain the HIE over 10 years. And then on top of that, a model to calculate potential return on investment with the thought process being that as your disease burden goes down, your population gets healthier, your GDP goes up. When do you see that change, that impact, and how much impact do you see as a modeling exercise? So the tool is to help understand the value of DPIs and HIEs and to really talk about digital health from a health perspective. As we've been saying, this is not about shiny objects, it's about healthier people. And so when do you see that and how do you see it? A few country examples of where we've seen demand and where we're supporting countries today on DPIs in Jordan. And I was fortunate to be at the table with the Jordan team in the breakouts over the last couple of days. So we're supporting the setup of foundational health DPI registries, HIE data exchange standards. In Tajikistan, we're helping set up a client and a facility registry. In Kosovo, we supported the development of a blueprint, and then we plan to finance the setup of an HIE. So this is work that's ongoing, and almost every request that we get for a health project has a digital component in it today. And that's leaning towards transformation and not vertical systems anymore. Finally, we're not just a health organization. We have a huge number of different areas of support. So I'll speak a little bit towards our support for foundational DPI, which I'm not the expert on by any stretch, but I did think it's important to highlight. So there is the ID for D initiative, which helps countries set up secure digital ID, which is a fundamental piece of the foundational DPI structure. We also have the Fast Payments Initiative and the G2PX initiative to support modernized payments from governments. So this helps with financial inclusion, women's empowerment, and it's convenient, frankly. And so that's a quick summary of our support. I'll hand over to the next panelist.
Thanks, Ali. That was fantastic. And really, as you can see, this is not a journey that any one of us takes alone. It's going to need all the agencies working together around this common vision. So seeing the bank's sort of leadership in this space has been really nothing short of exciting. So next, I'll introduce Adele from USAID, and maybe to talk about some of the key challenges that LMICs face as you've been working around the globe to support them in digital transformation efforts. Adele?
Thanks very much, Ella, and thanks to all the organizers of this event. It's been really tremendous to be here over the past 3 days and see the momentum and excitement and enthusiasm and be part of the conversations happening. You can just feel, it feels almost tangible, the progress that's being made quite quickly, and it's really inspiring. So thanks to everyone for the work that you're doing and for coming here. So what I'm going to do is take a step back a little bit and think about the challenges from the LMIC context, but also think about the challenge from the funding context. And I'll share a little bit about how we as USAID have been funding digital health and talk a little bit about the evolution in that space. Also recognizing that countries are really leading the way. The examples that we've just heard from India, from Malaysia, from Kenya really nicely showcase the thought leadership, the vision, the political will, and the governance that's coming to strengthen this movement and help it really take root. So USAID has been funding digital health systems for at least 30 years. And actually, one of the first systems we funded is still in use today. It's a digital tool used for census data collection called CS Pro. It's open source. And believe it or not, it's still being used in over 190 countries today. It is a remarkable success story. But of course, not all of our early innovations that we supported in the digital health space were as successful. We've certainly learned a lot as we've gone along, and we've continued to evolve our approach over that time. And one moment that was really catalytic for USAID, but I think for the broader global health funding community, was the 2014 to 2015 Ebola outbreak in West Africa. So this is now a decade ago. And during that time, my colleague Merrick Schaefer, Merrick, maybe you can stick your hand up in the air, commissioned some research. And I joined USAID as part of this project, partnered with somebody else to do a deep dive into how data and information and digital technologies were being shared as part of that international effort. We interviewed both the global health responders and the humanitarian assistance responders for a comprehensive look. And we published those findings in a report called Fighting Ebola with Information. And that report and the work that we did as a community helped to galvanize two kind of catalytic changes for USAID. The first was that Merrick and others led in the creation of a new digital health joint financing mechanism that was designed specifically to support open source global goods and support their implementation. And that mechanism has supported over 30 tools in more than 30 countries and has helped to show the art of what's possible and is helping to lead the way in terms of USAID's thinking about how we approach our investments in this space. USAID also released a policy document for the first time. We hadn't, despite being the world's largest global health bilateral funder, had a policy guiding the way we make these investments, and we realized it was time to do that. So in 2020, we published the Digital Health Vision, and this year, just a few months ago, we released a new digital health position paper. And just really quickly, what we did with the digital health vision was say we need to shift the center of gravity away from the funding organizations and the vertical silos that most global health organizations, funding organizations are organized in, and recenter around countries. And in doing that, we need to understand country capacity. We need to really understand the enabling environment so that our investments are targeted, we're building on strengths, and we're addressing gaps. And we need to rally around national digital health strategies and architecture where possible, considering the use of software global goods. So when it was time to update the policy, we actually tried not to. We wanted to see if we could just extend it for another 4 years, because that's a really grand ambition that's not possible to deliver in just a 4-year time span. But what we realized was, in fact, there is a lot that we've learned in this time. And so what our new position paper does is recommit to those 4 priorities and then emphasize some points that maybe didn't come through quite as clearly as they could have as in that initial document. And you'll hear echoes of what other presenters have discussed today: the importance of being person-centered, the importance of strong country-led governance, the importance of privacy and cybersecurity. And then you'll recognize this slide from our colleague, Dr. Joyce in Kenya. And I'm remiss in not saying thank you to our hosts in Kenya for hosting this discussion and giving us such a fertile environment to learn from, because the journey that Kenya has been on is really inspiring. And it actually gives me a moment of pride to take a step back and think about how we as the US government, inclusive of, but not limited to USAID, have supported the government of Kenya in their health sector digital transformation journey. And what's exciting to see is the US government aligning behind digital public infrastructure. So these stars are accurate to the best of my knowledge, that represent how either USAID, CDC, or PEPFAR have supported various aspects of Kenya's digital health architecture. You see support for Kenya's unique patient identifier, which is the basis for the client registry, which can enable longitudinal health records for all Kenyans. You see support for the Kenya Master Health Facility List, which of course is critical for keeping a current record of health facilities and community units, and in turn is critical to informing service delivery and programs. A third example is our support for Kenya EMR, an open MRS-based electronic medical record system. And specifically, we're now working on adapting this technology to do more than just support HIV. So this is an example of a system that was established by an individual vertical that's now being expanded in order to enable integrated care delivery. And then a fourth and final example that I'll give is our support to interoperability enhancements to Kenya's community-level ECHIS system. And this specifically is going to strengthen continuity of care from the community to the facility level. So what does this show us? Oops, don't mean to do that. There we go. It shows us the same slide I had up before. It shows us that USAID is interested in demonstrating progress beyond programs. So this is an initiative of our administrator, Samantha Power, who wants us to think strategically about how we design our investments in a way to deliver value beyond the confines of one individual development program. It also shows that USAID is interested and committed to strengthening primary health care, which is where 70% of services needed over the life course can be delivered. And finally, to bring it back to the topic we're all here to talk about today, these investments demonstrate the US government's recognition of the importance of digital health standards and foundational digital public infrastructure for our global health activities. So what do we do now? How do we take this approach where we see it's beginning to work in some places and scale it? The first thing we need to do is take this conversation out of this room. We need to grow acceptance that common infrastructure and enablers, like the components reflected in the full stack approach, are critical strategic investments by all global health funders, regardless of their particular health programming interests. And second, and I love the fact that my presentation is following Ali's, because he's just presented this new digital health toolkit that includes guidance on how to build multi-year costed implementation plans. I think, and I hope one day I will be proven right, that when we can get to the point that we have robust, costed multi-year implementation roadmaps that demonstrate strategies moving into action and show what is needed to fully and comprehensively fund digital health architecture, that becomes the guiding star to which multiple funders can align investments at scale. And then finally, we need increased prioritization of investments to support the digital commons. These are the communities of practice, many of which are here today, the open source software systems, the trainings and resources that can serve as a shared think and do reserve to power health sector digital transformation. And I'm confident through the conversations that we're having here today as part of this event and through the Global Digital Health Forum later this week that we're going to get there. Thank you.
Thanks so much, Adele. And for anyone who hasn't read that position paper yet, highly recommended. It's very short, very targeted, easy to digest, and I think brings together a lot of these concepts that we've been discussing over the last 3 days in a very elegant way. I think it also has highlighted how the principles of donor alignment that were thought of almost a decade ago now might need to be revisited a little bit more to really think about, are we now ready for a new era of sector-wide approaches where multiple donors are investing in a country's vision, a country's action plan, a country's digital public infrastructure so that they can have the custodianship and leadership over their own transformation journey. So thank you for being such a good leader of this at USAID. And that brings me next to Tessa Lenneman at GIZ to really ask the question of how do you see both DPIs and standards helping to serve as market-shaping forces? It would be really exciting to hear about the initiative that you've been leading, the DIPC, and to think about how, investing in this architecture isn't the end of the road. It really does open up opportunity for public-private partnerships and other creative ways to enrich the health system. So Tessa, over to you.
Okay, thank you very much, and thanks for paying attention to me. My name is Tessa, and I'm going to tell you a little bit about the project that I'm responsible for, which is the Digital Innovation in Pandemic Control Program. So, DIPC is one of the largest digital health program of the German government, and it is funded through COVID-19 response. So it was basically a program that was developed by the response to the COVID-19 pandemic, its emergency funds, everything had to be very quickly, and these are sort of the work packages that we put together, and I'm really honored to not work by ourselves, but we are working with a really strong partnership network of the Regentstreef Institute and PATH, UNICEF, and PAHO, and we implement in 4 different countries, or 5 different countries, together also with the Ministries of Health, and we have these 4 work packages. So in the first work package was the biggest. We actually wanted to work with the governments to strengthen their digital health infrastructure. And because at that time, I was really much inspired by the idea around the smart guidelines and the Global Digital Health Certification Network, we sort of thought, okay, let's try to program this into our projects and to see if we can establish standards and if we can sort of like work with the governments to see real life implementation of the WHO smart guidelines. So I think I'm not going to talk to you about this today, but I think you see the partners there. You can visit our stand on the Global Digital Health Forum and hear more about the actual experience around this. What I want to talk about is basically that we not only need, that it was quite difficult partly to implement those standards, and that I think the standards are quite good, but we also need additional activities such as capacity building or research. Now we've ended, we're coming to an end next year, and we're sort of thinking what are the lessons learned and how can we move forward? What would we do differently? And I think from the very beginning, DIPC was a project that looked into a health system rather than sort of a siloed approach. This is also connected to what the German government is prioritizing. Yeah, so health system strengthening is one of the focus areas of the government strategy. But still, I think we have recognized that we want to do this more in the future and that we really want to not build individual solutions, that we really want to develop health systems. And based on the work packages, reflections within the team and our partners, we sort of came up with this very integrated or interoperable new scope of work where we are focusing on capacity building as a human-centered starting point. And we want to also do this together with other partners in a strategic alliance. But then we sort of look at the development of standards and software solutions somehow a little bit analog to an R&D approach for drugs. Yeah? So we are somehow thinking, okay, we need evidence, we need research, we need to know what really works. I think that totally aligns with what you were saying. And we have to showcase which digital solutions are actually bringing what kind of health output. But then, if we know this, I think what is important is to recognize that our partner countries are working with existing health systems, and that whenever we bring in something new, this is sort of causing an irritation in a very large and complex system. And like we would advocate to actually have sort of like a sandbox, a playground, what do you want, the testing phase, to really find out these new innovations that we have, these new approaches that we have, what is it that they will bring us, what's the impact, what is the cost in respect to introducing into the current health system, and maybe also what will, if we want to finance that, what will be not to be financed, right? And then, of course, I think this is, in the moment we talk systems, we can't do it alone. We have to really strengthen collaboration to get to an end. So the aim is to really develop the national health systems, and I somehow think this is actually, we should look at it in a way of market shaping. So I'm not an economist, and this is like totally out of my comfort zone. Please be kind to me. Yeah. What I mean by market shaping is basically that we have different actors that are influencing the ICT sector in health, and that is the governments. And the governments, as we have seen, can be very strong. They have a very clear vision what they want to do. They have their own loans and financial assistance to strengthen their digital health systems, and they are correctly so choosing which kind of road they want to go. And they consider if they want to have nationally developed solutions, or if they want to, go and take a global good. And the decision that they are making, also considers, how do I want to grow my local market? Do I have, like Kenya, really a strong, tech scene, or do I maybe not have a single person who can program fire? So then, of course, the donor community has their own interest, right? If I say I want to fund, let's say, patient ID system, I will still have the pressure to report back, how many facilities I've reached and how many people I've tested. And for that, I'm not necessarily, need a foundational DPI or a health DPI, but I need this kind of solution that delivers me my M&E data. So I think donors have their own interest, and we should not deny that, that influences our choices. I don't know exactly the decision-making process in the private sector, but I'm sure that they are also part of the market. And then on the supply chain, of course, we have the users. I would come to them later. On the supply chain, we have developers and we have global goods owners. And I think it is also important to really recognize that many of them are investing a lot of time and effort, and that we have sort of taken away any kind of business model the moment we advocate for open source. And we don't really have an answer. How do we want to maintain the manpower that is needed to keep our national health system, running, secure, functional, and reliable? So next. Yeah, I think I have to jump a bit. So these are market shaping tools, yeah, that are deployed in other areas of global health. And I was thinking, when we are looking at the development of software solutions for, our national infrastructure, we actually should consider where each of us is playing a role in shaping this market, and where we maybe could consider, going higher up in the, or more heavily on the market shaping, and where we maybe want to consider, developing tools together, or deciding, on a regional level that we are adapting the same solutions, across countries. So that, the production cost of our systems become cheaper, and instead of investing into, my national health system or my national registry in Kenya, Tanzania, and Ghana, and Sierra Leone, and everywhere, we just have like this one national system that we have all, developed together. So I came here from Germany with Lufthansa, and the airplane is an Airbus. Yeah. So many of you who know, this a little bit, is that Airbus is produced in several countries in Europe, and that sometimes if you drive along, let's say a German Autobahn, you will see like this massive wing being transported from France to somewhere else to be assembled. And I think this might be, an idea that we should consider when we are developing our digital health solutions to be more sustainable. What is it where I actually need local, national development? Where do I need global development? And where can we maybe save costs and be more efficient without losing quality by working together? So that is, I think, from my side, and sorry I've taken a little bit longer. Thank you for your attention.
A lot to digest, and thanks, Tessa, for that overview. I think, we heard yesterday from a lot of innovators who were using these building blocks. We heard from Matt Berg, we heard from Stephen Wanyi about how access to both vetted content and libraries, but also access to DPIs accelerated their production of high quality interoperable software. But I think your point is very well taken that reinventing the wheel doesn't necessarily mean reinventing the whole wheel. You can also reinvent parts of the wheel. So it's really critical to identify what pieces exist that we can build upon to really meet the local needs without recreating things from scratch. I think next we have Michelle Monroe from the Global Fund, and the Global Fund has had a really strong influence on the trajectory of global health in the last 2 decades. But as you think about the fund's role in supporting an enabling environment for DPIs, we'd love to hear from you in terms of where you see the direction going in the coming months with examples of countries that you're supporting. Thanks, Michelle.
Okay, so hello everybody, and I'm going to start I have 2 slides that I'm actually going to take advantage of this to show a little bit of how Global Fund works, because I do think it's a good space for DPI and where you can influence ways to finance through that. But first, just to your question of enabling environment efficiencies, I think there's been a lot said today on that, and I just wanted to highlight a couple of places where we are seeing a lot of opportunities there. So the first being, of course, that what this whole session and conference has been about is doing designs that are more reusable and that are more modular and can be built over time. And I think this piece about building across sectors within government, so across ministries. And in the Global Fund, this is a really big space that I think can be tapped a lot further by countries, and really want to highlight. It's a very open space where the countries are requesting to the Global Fund what is to be funded within a given allocation. And so there's a great space. We have a lot of Ministry of ICT folks here. Even if the principal recipient of a Global Fund grant is with the Ministry of Health, and even within a particular department within the Ministry of Health, say for HIV, TB, or malaria, there's full capability that these are done across ministries, that the work is funded across ministries, and that you can be designing what you're putting in as a request to the Global Fund as a country across the ministries, and in terms of looking for efficiencies in financing, and obviously then sharing that cost, taking advantage of the actual foundational DPIs being developed across the sectors, and also opening up to other potential funders and private sector partners to be funding this. And so it's been a place where, as with here and everywhere else, where we're really trying to say, even though a lot of our processes do go through the Ministry of Health, there's ways to make sure that it's actually crossing multiple ministries, Ministry of ICT, Ministry of Education, and it's not at all specific to HIV, TB, malaria that the health systems costs are. And I'll show you that in a minute on a slide. The second piece I just wanted to highlight is, I've been talking to a lot of people about this during the last few days, is on the procurement side. And really, there's, whether it's private sector, whether it's within procurement within the ministries and your own staffing, and whether it's pieces coming from the partners and donors aspects, what we are really seeing at the Global Fund is that there's a lot of lost opportunities or delays and pieces that are coming because of procurement issues that actually, I mean, a lot of it is because it's IT procurement. Maybe it's different from what we've traditionally procured a lot in the Ministry of Health in terms of commodities, in terms of travel, TA. And so we're looking at ways to see, and we really would appreciate also the input from the countries, is where are the frictions that are happening there that we can try to address in terms of still following, of course, full principles and regulations on procurement, but to find ways to make it just work better for countries, and so that we are more efficient with these funds and not having either actual loss of funds because of the timing of that, or delays, and then pieces where people are procuring things right at the last minute and maybe not procuring the way that they would like to do. That's one of the things where we see around the World Bank Architecture Blueprint Toolkit, and just in general, having the architecture blueprint, having the full operational work plan, as people were saying, for what your overall architecture has been, the way that the Kenya example and other countries' examples have shown. And really being able to then have that operational work plan for the procurement, and also, as the second point, to just really align for you, for the ministries, and for the governments to align the donors and other partners. It's really nice to see actually the Kenya example with the stars of where the US government pieces are. Donors, other partners love to be able to say, okay, look, and we're fitting into this one. Well, this donor's fitting into this one, and this one's fitting into this one. So it's a really nice example if you can actually, when you're applying for a funding request to Global Fund and you're showing your architecture blueprint and you're showing, look, this is how I'm funding this, and this is how I'm funding this, and it is all in a plan. That really does actually open up financing, and it also creates the efficiencies that we're looking for to have more money with what's existing, or to get more out of what's existing. And then the last point, also, I think what has already been coming up a lot is both the governance and the evaluation and metrics and the return on investment, and really trying to show that better. It's something that we're trying to do within our own community at Global Fund, but I think it's something, again, when countries are able to show that, really opening up a lot of opportunities for existing funding. Okay, so now I'll go to my slides. I'm take advantage of this opportunity because I think that sometimes the Global Fund funding, particularly for health system strengthening, is a seemingly complex space. So what I want to highlight is it's the Global Fund to fight HIV, TB, and malaria. But absolutely, we're one of the biggest, especially multilat grant funders for health system strengthening. And we fully support strengthening cross-cutting health systems. Everything that was spoken about in terms of foundational DPIs and health DPIs are fully within scope of Global Fund funding. And I put here, these are with the current Global Fund strategy. These are the overall health system strengthening objectives. And you can see almost everything that we've been talking about fits into aspects of this. You're talking about health worker registries. There's a huge focus on community and community health worker registries at Global Fund. There's a piece that doesn't quite show out here, I would say, on finance side, that currently we had our CFO actually was at the Africa Health Tech Summit, because right now there's a very big push that all community health worker payments and as many other health worker payments that are going through Global Fund funding are made digital. So there's huge support that's included in the grants. And last slide here is to show that how the funding mechanism works. So the links are here, so you can go and look at it. Obviously, I don't have time to go into the detail on it, but what you really want to do as a ministry or as the government is find out who your PR, your principal recipient of your grants, and who your CCM, your country coordinating mechanism in country are, if you don't already know that. Because those are the ones that are putting in the request to the government, to the Global Fund. It comes from the country, it comes from the government and other civil society and actually other donors and stakeholders who are on the CCM. So if you're looking for financing these, you need to be part of these discussions with the CCM, and you can request it. As I said, everything that was on these, and even some aspects of the physical infrastructure DPIs are within scope, but definitely the foundational and health aspects are within scope. So get to know it's usually within the Ministry of Health, that's a principal recipient, it's usually within the HIV, TB, malaria program, but cross-cutting health system strengthening, fully funded, there's tons of examples of Global Fund funding that across all of the countries. And if you're in the Ministry of ICT, figuring out who those folks are. If you're in the Ministry of Health, again, figuring out which departments have the grants that are doing that. So I wanted to put all the links here on that. And then last to say, most of our money is in those grants that I was talking about. We do also have some strategic initiatives that have some smaller funding. There is a current digital one right now. 5 of the countries here are part of that. And it is a lot about actually trying to showcase aspects of how you do what's been focused on in this session. And then there is a lot of push around other innovative finance, including blended finance with private sector and innovative finance. So they're all there. And if you have questions about how to be putting in your requests into the country request for Global Fund, please come talk to me about it, because this is the best way. The government requesting what it is that you need in those, and then having those plans that we can align it across the donors. Thank you.
Thanks for that lucid roadmap. And we are short on time, but long on excitement for Dr. Ayub to join us now and bring it all home with the perspective of our host country, Kenya. All of the great things you've seen people say about the Kenya journey. We'd love to hear from you about where you see some of these challenges in financing, but also the opportunities for Kenya as it moves forward. Please, Dr. Ayub, welcome.
Yeah, good afternoon. I know we are about to finish, and I would like just to say, you'll hear it many times that Kenya is one of the first adopters of the digital health. We are very quick to pick new things coming. And the reason we are actually very quick is because we have a lot of support from the development partners and donors. So our biggest funding mechanism for this is support from outside. So actually that is the end of the story. How do we fund our things? It's mostly from support. I would wish to name all the people who support us, but I'll not be able to do it because the list is long. And if I name just a few, like other children will say, why not me? So I'll not, but we get a lot of support. The next funding mechanism is the government. But the government, as you know, is always political. So they would like to do something that will earn them the next election. So you'll find they'll be able to do things like buying drugs, making roads, but things like software can be left to others. So you find the government is there, but sometimes it's not top on the list. And the next other funding mechanism that we are starting, I think my colleague just gave you a presentation about the ability to pay for some services if you are offered. For example, for you to join a system, maybe you may have to pay some kind of user fee. It's coming up as a private-public participation, and that is coming up. And there's also another one, the last, a very easy one. I want just to talk about our own experience. For example, if I want to go and get my driving license to town, I'll spend 100 shillings to go there, maybe 100 shillings for some lunch, and 100 shillings to come back. That is 300 shillings. But somebody comes up with a software that will allow me to get that driving license in my house and charges me a convenience fee of 50 shillings. So at the end of the day, the 50 shilling is too much for the person, but also very good for me. So we are having that mechanism. It's a very interesting way of doing things. And I'm sure even when we develop these DPHI, they'll be able to bring some services closer to the people, and the public will therefore be willing to pay for them. And that's how we invite public to actually participate in financing some of these innovatives. And that has worked very well for me. For those who are Kenyans, you know about the e-citizen. We can get almost everything in your own house at a cheaper price. I would like to just mention one last thing, and this is the support that the global world gives to the development of global goods. Most of us use the DHIs and other things, but we just, actually, there's a lie. They came and told me DHIs is free and open source. So I've looked for the free part, I've never seen the free part. Maybe the open source is there. But the free part still is not there because we need a lot of money to pay people, we need people to customize, and that is so costly. And the fact that we are able to utilize it almost for free, it is because there's a lot of support which we don't see at the global level. The Global Fund supports the development, and therefore here we are able to receive it as a free. So that's a very good mechanism which I would encourage. As we develop this, we get people funding some of these good technologies, and therefore being able to reach to us termed as free, while we definitely know they are not free. And finally, capacity building is really, really important. And we spend a lot of money in seminars like here, paying people to teach them. So the best way to get out of this is to try to push some of these things in colleges, preschool, pre-service, so that they learn a bit of this so that when they come back, they don't need to be here. And also they can also develop a community of practice that they can teach each other, mentor each other, so that we don't spend so much money in education. That's just some of the areas I wanted to mention about our country. And I know you've heard so much about Kenya that I don't want to continue adding more. And we still have time in Kenya. Thank you.
A special thank you to all of you who have stayed awake, stayed engaged through this slump. I think we have 1 minute? 1 minute. So the most energetic hand I see go up in the audience is going to get the mic to ask a question to this august panel. All right, you get it. Fantastic. Our colleague from Peru. Watch out, this one's going to be tough. She's a tough questioner.
I will try to get it in 1 minute. So, I'm part of Tessa's team, the IPC, but today please allow me to be one of these 1.5 billion expecting that in 2030 going to have a better quality healthcare. And I think you highlight a priority that is donor alignment. Please. We try in Peru for the whole year to seek with the International Cooperation Direction under the Ministry of Health with the whole donors. That means IDB, USD, GIZ, UNICEF, PAHO, World Bank, and everyone. And to say, please, that is the plan of Peru, the digital transformation plan. What you want to do, who going to do, where, with which population. And it's not that we always meet every year and we say, okay, you are doing the same? Oh no, you are working in migrant as well? Hey, I'm making a solution for this kind of module in, I don't know, in digital health, and there is another one that are doing the same. So please, donor alignment, I think is going to assure that in 2030, this 1.5 billion is going to receive a better quality service. Thank you.
Okay, fantastic. So for those of you who might not be aware, we're about to relaunch an important tool that will improve this landscape, and that is the Digital Health Atlas, to be launched in 2 more days. It's gone through a complete renovation, and it's to give governments that capacity to actually look at the degree of fragmentation across their national boundaries. And so we hope that will be a strong piece of the toolkit within the guide toolbox. So thanks for raising that as an important priority. Can we give a good round of applause to our distinguished panel? And I'm looking at our timekeeper. I think we're out. So thank you all very much, and thank you. So the instructions are to you have 13.4 minutes for coffee and snacks, and be back here at 15:30 or 3:30. Thank you so much.